We just got to see a case of Invisalign and how you sort of walk yourself through the process. No, it's not an overnight thing, but it may take 5-6 months. It's not your braces anymore. You don't have to go put on the clear braces and get everything in your teeth and do all of that. Now, this is a clear alternative to braces. And this is sort of something that is kind of like hitting everywhere. Everybody's talking about this because you can actually be walking around and no one knows that you're straightening your teeth. And you have a really great example of someone's teeth that were pretty dramatically changed by Invisalign, and her life was pretty much changed. Her name was Lois. How old is Lois?
Lois is in her late 40s.
Okay. And I think we have a picture of her before and after. And tell us why she was a good candidate.
Well, to be
That's her before.
To be quite frank, Lois says, "Doctor, can you help me? I don't want my jaws broken. I don't want braces," because that would have been the traditional answer for this. "Can you help me, doctor?" And I said, "Lois, if you'll accept some imperfections in the standard of my work, so to speak, I'll be happy to help you." And she said, "Yes, doctor, just help me." So sometimes with a situation like this, we can't get the teeth 100%, but Lois didn't care. And as long as I'm helping someone, I'm happy to do that. And so she got really dramatic results. In fact, with this type of work, they didn't even know that this was possible 5 years ago with Invisalign. She
looks amazing.
And she's so delighted. We asked her if she'd like to come on the show today, and she said no. But she said, "But it's changed my life. Please use my picture." And so, I get excited about this. It may not be absolute perfection, but it also wasn't surgery. It also wasn't braces, which she wasn't going to do anyway.
Because surgery and braces can really be tough. Plus, Dr. McClendon, you've done more Invisalign than anyone, not in the country, in the entire world. So it's great that you're right here in Houston. That's what we love about it. There's some other candidates that you could use. So, and a lot of people are candidates for Invisalign, like crowded teeth, right? Spaced teeth, overbites, underbites, crossbites, and open bites. And so let's take a little, this is a crowded tooth situation, and this is the before and after of how Invisalign fixed it. It's pretty unbelievable. And wow, and that is with no bonding or filling or anything like that. That's just plain moving your teeth like orthodontists do. Overbites, you don't have to pull teeth. These are things that you can fix your teeth with very little pain. And that's why, and this is an underbite?
That's an anterior crossbite or an underbite, yes.
I really wanted to do this segment because I know a lot of our viewers don't necessarily have the money to get bonded or to get veneers and things like that, although they're beautiful and it is a wonderful quick fix. This is a less expensive way, although it takes longer, to fix your teeth and to make your smile. And our smiles are so important, especially as women, to all of us. And so I can see where you feel so rewarded by this.
It's very rewarding. I think what will help the viewers to think about is the 3 different things that could be wrong with their teeth. What is the color of their teeth? And yes, a whiter color is more youthful. What's the shape of the teeth? And so as an orthodontist, I don't reshape teeth very much, but I can reshape them a little bit, take out little wear chips and things like that. So the veneers can mimic movement a little bit, but they can't make the smile as wide as it could be if we widen it in this way. So again, many times 2 different dentists work together. I'll do a portion, I'll get it wider, I'll get it where there's less tooth to be removed. So assuming that a person really needs work on their teeth, then that's a good match.